Let me ask you something that might literally save your life. Have you noticed your legs feeling weaker lately? Do you sometimes feel unsteady when you stand up? Maybe you've had a close call, a stumble, a near fall, or that heart-stopping moment when you grab onto something just in time. If any of this sounds familiar, you're not alone. And what I'm about to tell you might shock you, maybe even anger you, because the problem isn't just getting older. It's not just muscle weakness or poor balance. It's not even your medications or your shoes. The real culprit is something missing from your body, a nutrient so essential for muscle function and nerve health that without it, your legs literally can't support you properly. And the terrifying truth is, most doctors never test for it. In today's episode, I'll reveal the one nutrient deficiency that's silently stealing your stability, weakening your legs, and dramatically increasing your risk of life-changing falls. This isn't speculation. This is based on decades of research that most people, including many doctors, simply don't know about. But here's the most frightening part. This deficiency doesn't just increase your fall risk. It creates a cascade of problems that gets worse every single day. Muscle weakness, nerve dysfunction, bone loss, and coordination problems that can literally end your independence overnight. Before we dive in, if you're over 60 and want to protect your mobility and independence, make sure to subscribe and hit that notification bell. I share life-saving health information like this every week, and you won't want to miss it. Most people blame their balance problems on age, on arthritis, on just getting older. But I'll show you exactly how this one missing nutrient is sabotaging your body's ability to keep you stable and strong. And more importantly, how to fix it starting today. Let me tell you about one of my patients. Let's call her Margaret. She's 69 years old, and she came to me after her third fall in 6 months. "Doctor," she said, tears in her eyes, "I'm terrified to walk to my mailbox. I feel like my legs just give out on me." Margaret had been active her whole life, gardening, walking, taking care of her grandchildren. But suddenly, she was stumbling, losing her balance, and feeling like her legs were made of jelly. Her family was pushing her to move to assisted living, and she was devastated. Every doctor she'd seen told her the same thing. "It's just part of aging. Be more careful." But when I ran comprehensive blood tests that most doctors don't think to order, I discovered something shocking. Margaret wasn't just getting older. She had a severe deficiency of magnesium, a mineral so critical for muscle and nerve function that without it, her body literally couldn't coordinate her movements or maintain her balance. Within 3 weeks of correcting this deficiency, Margaret's leg strength began returning. Within 6 weeks, she was walking confidently again. Within 3 months, she was back to gardening and chasing her grandchildren around the yard. The nutrient that controls your balance, your leg strength, and your coordination is magnesium. And if you're over 60, there's a 70% chance you're deficient in it right now. Now, before I explain why this deficiency is so dangerous, you need to understand what magnesium does in your body, especially for your muscles, nerves, and bones. Magnesium is involved in over 300 biochemical reactions in your body, but 3 are absolutely critical for preventing falls. First, magnesium is essential for muscle contraction and relaxation. Without enough magnesium, your muscles can't contract properly to support your weight, and they can't relax properly to allow smooth, coordinated movement. This leads to muscle weakness, stiffness, and that feeling of unsteady legs. Second, magnesium is crucial for nerve function. Your nerves send signals from your brain to your muscles, telling them when to contract and when to relax. Without enough magnesium, these signals become weak and confused, leading to poor coordination and delayed reflexes. Third, magnesium works with calcium to maintain bone density. Without enough magnesium, your bones become weak and brittle, making fractures more likely if you do fall. A 2019 study published in the Journal of the American Geriatric Society followed 4,000 adults over 65 for 5 years. They found that those with the lowest magnesium levels had a 40% higher risk of falls, 60% higher risk of fractures, and showed significantly faster muscle mass loss compared to those with adequate magnesium. But here's the terrifying part. Standard blood tests don't accurately measure magnesium levels. Most of your body's magnesium is stored in your bones and muscles, not in your blood. So you can have a normal blood test and still be severely deficient. If you're learning something new that could save your life, take a moment to subscribe and share this video with someone you care about. This information could literally prevent a life-changing fall. Let me tell you about another patient, Robert, a 72-year-old retired carpenter. He'd always been strong and steady, but lately he'd been having what he called weak spells, moments when his legs felt like they couldn't support him. He'd had 2 minor falls, and he was starting to avoid activities he loved. Robert's family doctor ran basic tests and said everything was normal for his age. But when I tested Robert's cellular magnesium levels, not just his blood levels, I found he was severely deficient. The signs were all there. Muscle cramps at night, restless legs, feeling tired despite getting enough sleep, and that telltale leg weakness that comes with magnesium deficiency. But no one had connected the dots. Within 1 month of proper magnesium supplementation, Robert's leg strength improved dramatically. Within 2 months, his balance was better than it had been in years. He said it felt like someone had turned the lights back on in his body. Here's why magnesium deficiency is so common after 60 and why it's getting worse every year. First, your body's ability to absorb magnesium decreases with age. The cells in your intestines that absorb nutrients become less efficient, meaning you absorb less magnesium from the same amount of food. Second, many medications that seniors take deplete magnesium. Diuretics, proton pump inhibitors like Prilosec, and even some blood pressure medications can dramatically reduce your magnesium levels. Third, the modern diet is severely lacking in magnesium. Food processing removes most of the magnesium from foods, and our soil is depleted of minerals due to intensive farming practices. Fourth, stress and poor sleep, both common after 60, increase your body's magnesium needs while making it harder to absorb and retain magnesium. A 2020 study found that 68% of Americans over 60 consume less than the recommended amount of magnesium, and actual deficiency rates are likely much higher because the current recommendations are too low. But here's what makes this deficiency so dangerous for falls. Magnesium deficiency creates a perfect storm of problems that compound each other. When you're deficient in magnesium, your muscles become weak and prone to cramping. Your reflexes slow down, making it harder to catch yourself if you start to fall. Your bones become brittle, making fractures more likely. And your balance system, which depends on proper nerve and muscle function, becomes compromised. The most insidious part is that magnesium deficiency develops slowly. You don't wake up one day with weak legs. Instead, you gradually lose strength and stability over months and years, often attributing it to normal aging. Here are the warning signs that your body is crying out for magnesium. Muscle cramps, especially at night or in your calves. Restless legs, or that feeling like you need to constantly move your legs. Fatigue that doesn't improve with rest. Difficulty sleeping or frequent waking during the night. Weakness in your legs, especially when climbing stairs or getting up from a chair. Feeling unsteady or off balance when walking. Muscle twitches or spasms. Irregular heartbeat or heart palpitations. If you have 3 or more of these symptoms, there's a strong chance you're magnesium deficient. But here's the good news. Magnesium deficiency is completely reversible. And when you correct it, the improvement in your strength, balance, and energy can be dramatic. Let me give you a comprehensive plan to restore your magnesium levels and protect yourself from falls, starting today. Step 1. Get the right test. Ask your doctor for a red blood cell magnesium test or intracellular magnesium test. This measures the magnesium inside your cells, not just in your blood. If your levels are below 4.2 milligrams per deciliter, you're deficient. Step 2. Choose the right foods. The best food sources of magnesium are dark leafy greens, nuts, seeds, and whole grains. Spinach, Swiss chard, pumpkin seeds, almonds, and dark chocolate are particularly rich sources. But remember, you'll need to eat these foods consistently to make a difference. Step 3. Consider supplementation. For most people over 60, food alone isn't enough to correct a deficiency. You'll need a high-quality magnesium supplement, but not all magnesium supplements are created equal. Avoid magnesium oxide. It's poorly absorbed and can cause digestive upset. Instead, look for magnesium glycinate, magnesium malate, or magnesium citrate. These forms are much better absorbed and less likely to cause stomach problems. For most seniors, I recommend starting with 200 to 400 milligrams of elemental magnesium daily, taken with food. You can split this into 2 doses, one with breakfast and one with dinner. Step 4. Optimize absorption. Take your magnesium with food to improve absorption. Avoid taking it with calcium supplements as they compete for absorption. Don't take magnesium within 2 hours of taking antibiotics or other medications. Consider adding vitamin D3 to your routine. It helps your body absorb and utilize magnesium more effectively. Step 5. Address underlying causes. If you're taking medications that deplete magnesium, talk to your doctor about whether you need higher doses or different forms of magnesium. If you're dealing with chronic stress, consider stress reduction techniques like meditation or gentle exercise. Here's a specific protocol that I recommend to all my patients over 60. Morning. Take 200 milligrams of magnesium glycinate with breakfast, along with 2,000 international units of vitamin D3. Evening, take another 200 milligrams of magnesium glycinate with dinner. If you have trouble sleeping, take it 30 minutes before bed. Magnesium helps promote restful sleep. Diet. Include at least one magnesium-rich food at every meal. A handful of almonds, a cup of spinach, or a small piece of dark chocolate, 70% cacao or higher. Monitoring. Keep a simple log of your energy levels, leg strength, and sleep quality. Most people notice improvements within 2 to 3 weeks. Don't forget to subscribe and turn on notifications so you get my latest videos on nutrition and health after 60. Your future self will thank you. Margaret, the patient I mentioned earlier, followed this exact protocol. Within 1 week, her nighttime leg cramps disappeared. Within 2 weeks, she noticed her legs felt stronger when climbing stairs. Within a month, she was walking confidently again, and within 3 months, she was back to all her normal activities. Robert had similar results. He said the difference was like night and day. His energy improved, his balance returned, and he felt confident and steady on his feet again. But let me share something important. Magnesium deficiency isn't just about preventing falls. When you correct this deficiency, you'll likely notice improvements in many areas of your health. Better sleep quality, reduced muscle cramps and restless legs, improved energy levels, better mood and reduced anxiety, stronger bones and muscles, improved heart rhythm, better blood sugar control. The patients who follow my magnesium protocol consistently report feeling years younger and more energetic. They're more active, more confident, and more independent. I want to address something crucial. You might be thinking, but doctor, I eat a healthy diet. I take vitamins. How could I be deficient? The truth is, it's almost impossible to get enough magnesium from food alone after 60, especially if you're taking medications or dealing with stress. The soil our food is grown in is depleted of minerals. Food processing removes most of the magnesium, and your body's ability to absorb nutrients decreases with age. Even if you eat perfectly, you're likely not getting enough magnesium. This is why supplementation is so important for people over 60. It's not a luxury. It's a necessity for maintaining your strength, balance, and independence. Remember, every day you spend deficient in magnesium is a day your muscles get weaker, your balance gets worse, and your fall risk increases. But every day you maintain adequate magnesium levels, you're investing in your strength, stability, and independence. Here's what I want you to do starting today. First, look at your current symptoms. Do you have muscle cramps, weak legs, or balance problems? These could be signs of magnesium deficiency. Second, ask your doctor for the right test. Don't accept normal blood magnesium levels as proof you're not deficient. Insist on a red blood cell magnesium test. Third, start incorporating magnesium-rich foods into every meal. A handful of almonds, a cup of spinach, or some pumpkin seeds can make a difference. Fourth, consider a high-quality magnesium supplement. Start with 200 milligrams twice daily with food and adjust based on your response. Fifth, be patient but consistent. It takes time to replenish magnesium stores, but the benefits are worth the wait. Your legs are your foundation for independence. Your balance is your insurance against life-changing falls. Don't let a simple nutrient deficiency rob you of your mobility and confidence. You have the power to change this starting today. You have the power to strengthen your legs, improve your balance, and protect yourself from falls. You have the power to maintain your independence and quality of life. Before you go, make sure to subscribe to this channel for more life-saving health information. Click that notification bell so you never miss a video that could change your life. If you found this information helpful, let me know in the comments. Type magnesium if you're ready to test your levels and start supplementing today. Or share your own story. Have you noticed weakness or balance problems that might be related to nutrient deficiency? As always, I'm Dr. Harold Whitman, and I'll be here next week with more strategies to help you stay strong, stable, and independent, one smart choice at a time. Remember, your balance and leg strength are not accidents. They're the result of giving your body the nutrients it needs to function properly. And it all starts with ensuring you have enough magnesium. Stay strong, stay steady, and take care of that amazing body of yours. You've got this.